Hello, everybody. Um, it's Diane again, and hoping that everybody had a good and safe weekend with the storm. We actually came through it with very little snow up here, but I know you guys got a lot more down Philadelphia and southward, so hope everybody's okay. And so this week's readings were about alcohol and tobacco use in the LGBT community and various things related to alcohol and tobacco use and prevention or cessation. The first of the tobacco articles that I want to talk about is the one from Burkhalter et al. Because let's look specifically at intention to quit and using a model that I was not familiar with, the theory of planned behavior. I'm more used to anything that's dealing with intent to change using the trans-theoretical model of pre-contemplation, contemplation, and so on and so on. Whereas this looks at what specific pieces go, the two actually can work, I think, well together because it looks at what beliefs on different measures lead to actually intending a behavior and then actually following through with it. So what I thought was really especially interesting about their results was that the highest correlate with strong intention to quit was, what did they call it? Self-attainment or affective behavioral belief, such as feeling more like the person I want to be as a reason for wanting to quit, which suggests that linking smoking cessation with that sort of self-attainment is probably a useful strategy. So one of the things we were asked to consider is how that model could be used to design an intervention, and I'm not quite seeing how the model itself could be used, but certainly the results of this study using that model, because once you find what has the highest correlation with stronger intent to quit, and stronger intent to quit hopefully leads to stronger success in quitting, that should give you a better approach to use. The next step was looking at adolescence and smoking, and it looks specifically at same-sex or both-sex romantic attractions and relationships, which makes sense when you're looking at adolescents because while we know some of them are sexually active, there's certainly no way of avoiding that. Hopefully not all of them are. So on the dimensions of orientation, identity, attraction, and behavior, it makes sense to look at attraction, although I did find myself kind of wishing it had also looked at identity, but that's okay. We've got one that looks at identity plus behavior further down. So we've actually got all three covered just in different studies. One thing that was interesting was that, well, not terribly surprising, unfortunately, that the ones who reported both sex attractions or relationships had some of the highest incidences of smoking and earliest onset of smoking. What I thought was a little more surprising with the girls, then those who reported only same-sex attractions and relationships still had an elevated incidence of smoking or prevalence of smoking and early onset compared to those who reported only opposite-sex attractions. But there wasn't really a significant difference between the boys who reported only same-sex attractions and the boys who reported only opposite-sex attractions. And of course, there's no way to say why that correlation is what it is, but I thought it was very interesting to see. One of the things we were discussing on the discussion board is, so why do we think that more girls who report same-sex or both-sex attraction are smoking than those who report only opposite-sex attraction, but also more than the boys? And one thought I had, and I'm not sure if it holds true in any way really, it's just something that popped into my head, was the idea that athletics, I think, tend to have a protective factor in terms of smoking, because if you are trying to run around a basketball court or a track or whatever, you really don't want to be damaging your lungs. And there would be a lot of positive peer pressure. And while we're doing better these days than when I was in high school, I believe that the athletic programs for girls are usually still underfunded and undersupported, so there may be less access to that positive peer pressure. But I don't know that that's the case. That's just something that popped into my head, and I haven't done any digging to find out if that's actually true. Um, but somebody else had suggested that it's simply the intersectionality of minority stress, that in addition to being a sexual minority, girls who are reporting same-sex only or both-sex attractions have also got the minority stress of being women, even though we're 51% of the population, by whatever measures you're using, I guess. So there's that. Don't know for certain, but those are both possibilities. The third of the smoking articles talked about the effect of regulations on smoking in the LGBT population, and in not just prevalence, but disparity between the LGBT population and the heterosexual population. And while it is not surprising that having greater restrictions on smoking, such as no indoor smoking anywhere type policies and that sort of thing, and higher taxes and higher prices, bring down smoking for everybody. But what's interesting is they not only bring it down for everybody, but they bring it down more for the LGBT community. That's not saying it quite right. It brings it down in such a way that the disparity between the straight community and the LGBT community is lessened. And one of the ideas that the authors put forth as to why is that states that have very strong smoking regulations also tend to have strong sexual minority protections. And I've been saying LGBT, and they did not look at transgender populations, so excuse me, LGBT only in this study. So they're looking at sexual minority protections, thinking that those are stronger in the states that have stronger tobacco regulations. So it might be not the smoking regulation per se that's causing the decrease in disparity. It would be very interesting to see if it would be possible to do a study where you're looking at states that, okay, they have strong tobacco regulations and strong sexual minority protections, or weak on both, strong on one, weak on the other, weak on this one, strong on that one. I just don't know if the ones that have, say, strong tobacco regulation and weak LGBT protections, and weak tobacco regulation and strong LGBT protections, I'm not sure if they exist, and if they do, I don't know which ones they are. But I would think it would be very interesting to see what you might find if you could find 4 states that satisfied those conditions, and see if that disparity difference, what it even looks like between those 4 states, and what that might tell us about what the real causality is of decreasing the disparity in smoking. So those were the 3 smoking articles we looked at, and then we had 2 on alcohol, and the first was one we actually read last quarter, but it was really actually nice to go back to it, because last quarter we were looking at it in the course on researching hidden populations, hidden, marginalized, and rare populations that, depending on whether you measured the orientation of people by their identity or by their behavior, gave you different results. And why? It doesn't actually give you a why, but it gives you some things to think about in terms of why. And this time it was focusing less on how the definition was made, although that was certainly an important component, but on the actual outcomes. And one of the things I thought was interesting was that bi identified men were doing better than either gay identified men or straight identified men, but men who reported having sex with men and women over the past 5 years had much higher incidence of drinking. My thought is that maybe that is something to do with having the security of being able to name yourself as being bi for a guy, because men do have a lot more pressure to quote unquote pick a side. So maybe that's a factor. Of course, there's no way to tell that at the moment. And the other thing that was really interesting was that women who had sex only with women in the last 5 years had 0 social consequences associated with alcohol consumption. But lesbian identified women had a non-zero number in that column. And one of the things the authors talked about as a limitation is that lesbian identified women who had not had sex with another person in the last 5 years, maybe they were widowed, maybe they, whatever, they were excluded from the behavioral part, because to be included in the behavioral part, you had to have sex with somebody in the last 5 years. And that may make a difference. There would also be bi-identified women who are either in monogamous relationships with women, or who are primarily or only, well, it'd have to be only engaging in sex with other women in that data set as well. And I don't know what that means, but I do think it's very interesting, and I would like to see some sort of follow-up on that to find out what it means and what it can tell us about reducing some of the disparities around alcohol use that we see. And boy, this is getting long. The last one was about the marital effect, or the marital advantage in health, that in general being married appears to confer health advantages as opposed to simply cohabiting with somebody. And so one of the things they were looking at is that true also for same-sex couples who do have the access to marriage? That's been one of the arguments in favor of legalizing and universalizing same-sex marriage, which so having support like this that says, yes, it does actually reduce alcohol use, and increases either just plain non-drinking or having quit drinking. So that was interesting, but boy, I'm pushing 12 minutes, and I was actually going to try and keep it shorter this week, which did not happen. So I'm going to stop now and say have a good week, and see you next week. Bye.